Hi everyone, today we are tackling a significant challenge in Malaysian workplace, burnout. This issue increasingly prominent as employees face high stress and demanding workloads. Burnout is more than just feeling tired, it's a state of mental and physical exhaustion caused by prolonged stress and overwork. It manifests through symptoms like constant fatigue, irritability, and a sense of inefficiency. In Malaysia, many workers are struggling with heavy workloads, long hours, and insufficient time for personal life, which exacerbates these problems. The impact of burnout is profound. It doesn't just reduce individual productivity but also affects team dynamics and overall company performance. More importantly, it leads to severe mental health issues such as anxiety, depressions, which can have long-term effects on employees' well-being. Addressing burnout is essential for fostering a more resilient and effective workforce. To combat this, companies need to prioritize creating healthier work environments. This involves implementing better support systems for work-life balance, encouraging regular breaks, and offering mental health resources. So, we will delve into the root causes of burnout, its effects on both individuals and organizations, and discuss practical strategies to mitigate these issues. Our goal is to understand how we can create a work culture that supports and sustains our employees. Let's dive in and explore how we can make meaningful changes for a healthier workplace.
Positive impact of the issue on the employees and organization. The first one is improve employee well-being. The American Psychological Association explains that addressing burnout greatly improves employee well-being. Managing burnout reduces stress, leading to a clearer thinking and better physical health. This helps employees balance work and life, making them more prepared to handle challenges. Stress management programs and flexible work options contribute to a healthier, more productive team. The second one is improve workplace culture. The Academy of Management Journal notes that tackling burnout improves workplace culture. Companies that prioritize employee health create supportive environments where workers feel valued. This leads to better teamwork, motivation, and communication. A positive culture boosts morale and attracts new talents, making the organization stronger. The third one is increased productivity. Harvard Business Review highlights that reducing burnout improves productivity and overall work quality. When burnout is managed, employees stay focused, motivated, and engaged, resulting in fewer mistakes and less time off. A healthier, energized workforce helps the company achieve its goals and maintain a positive work environment. The last one is reduce turnover. Research from the Journal of Applied Psychology shows that managing burnout lowers employee turnover. Employees who feel supported are more likely to stay with the company, reducing hiring and training costs. Focusing on employee well-being builds loyalty and job satisfaction, leading to a more stable workforce. Thank you.
Now, we're talking about the negative impact of mental health at work and how stress, burnout, anxiety, depression can affect employees and organizations. Firstly, excessive workloads. When employees have too much work, they often feel stressed and overwhelmed. This constant pressure leads to burnout, which makes them mentally exhausted and unable to function at their best. For instance, J&T Express workers in Perak experienced overwhelming workloads due to a sudden surge in package deliveries, leading to dissatisfaction and stress. This resulted in a viral incident involving rough handling of parcels. Next, decreased physical health. Mental health issues like stress and anxiety can lead to physical problems such as headache, high blood pressure, and weakened immune system, making employees more prone to illnesses. As we know, Malaysia healthcare workers face a rise in stress and burnout during the COVID-19 pandemic. The heavy workload and long hours lead to mental health issues like anxiety and depression. This causes them more likely to get sick. Furthermore, high turnover rates. When mental health issues are not addressed, employees often leave their jobs, causing high turnover rates. This increases costs for companies as they must spend time and money recruiting and training new staff, while also losing experienced workers. In Malaysia, many bankers have posted last day or resignation day videos on TikTok, sharing their struggles with mental health and deciding to leave their long-term jobs due to stress and burnout. This highlights how mental health concerns are driving employees to quit even after many years of service. And lastly, lower team morale. Poor employee mental health can lower the morale of the entire team, reducing collaboration and productivity. A toxic work environment can spread negativity, hurting both performance and company culture.
About the solution to this burnout issue, Christina Merslash, one of the leading experts on workplace burnout, has emphasized that finding solution to the problem of burnout require considering the workplace and the workers itself. Solution number 1 is review the current management plan in related to insurance policies. Occupational psychology consider these primary intervention strategies aimed at preventing major stress and mental health conditions. Organization health insurance benefits should reflect the Federal Mental Health Parity and Addiction Equity Act, which require health insurers to provide coverage for mental health. For example, according to American Psychological Association (APA), employees should choose a plan without network mental health benefits so employee can access any clinics who may not be in network with their provider. Next solution is promote work-life balance. Managers must live out healthy work-life balance to promote it within their organizations. For instance, organization can offer flexible schedule to accommodate individual schedules and also be clear during the hiring process about the demands of the roles so employees who are hired are on board with the requirements. Third solution is provide work from home option. Working from home is not a new concept, but managers can help eliminate stigma and ensure fair application of policy by making it as practice. For example, Mojo Media Labs, they offer their workers to work from home every Wednesday so that it can save employee time and money spending and also demonstrate the organizational trust. The option to work from home can also help eliminate the stress of time management within the employees. Lastly is enforced management training. Managers can be the biggest factor in employee engagement and retention. According to Randstad study, 60% of the respondents said that they had left a job or would leave over a bad boss. Managers need to be trained to coach and develop employee as individual or as a team. Organization must ensure that supervisors and managers are given employee management tools and skills, which should include appropriate ways to provide feedback, goal setting, communication skill, and task assignment.
Next, the potential consequences of not addressing the issue. If burnout in workplaces is not addressed, employees will face long-term health issues like chronic stress, anxiety, and depression. This not only affect their personal well-being but also lead to a drop in their productivity. According to World Health Organization, a lack of effective structure and support at work, especially for those living with mental health condition, can affect a person's ability to enjoy their work and do their job well. Burnout employees struggle to stay engaged, result in lower work output, mistake and missed deadline, all of which hurt the company performance. High level of burnout also push employees to leave. This forced company to spend more on recruitment and training, while also damage moral and workplace culture. Moreover, burnout creates a toxic work environment that harms collaboration and stifles creativity. According to International Journal of Environmental Research and Public Health 2021, a toxic workplace environment negatively affects the employee engagement directly and indirectly through organizational support and employee well-being. Employees who feel overwhelmed and unsupported are less likely to engage in teamwork, leading to isolation within teams. This can also discourage innovation as employees become less willing to take risks or think creatively. Over time, the company reputation may suffer, making it harder to attract and retain talented workers.
In the long run, companies that fail to address burnout will not only face rising costs due to absenteeism and turnover but also see a decline in employee morale and overall performance. Business run the risk of losing their competitive edge and being less sustainable in the long run by failing to provide a positive and well-balanced work environment. Thus, it is critical that business actively avoid burnout but encourage a better work-life balance, providing mental health assistance and develop a culture that prioritizes the well-being of employees.
Let's jump into the conclusion. We have explored the topic of burnout, a serious issue in Malaysian workplace that affects many employees. According to Christopher Collier 2024, knowing and adhering to workplace health and safety protocols is important for both companies and employees as it provides safe and productive conditions that can lead to company growth. Employee safety can be seen as an effective way to enhance company value and loyalty by demonstrating how excellent safety performance can boost client trust and the company's reputation. Malaysian organizations are expressing burnout due to overwork, unclear roles, and poor time management. When left unaddressed, burnout leads to reduced mental and physical health, lower commitment, increased absence, and also decreased productivity, all of which can negatively impact the economy. Companies that prioritize mental health and well-being along with early prevention measures like mindfulness training and supportive structures can effectively reduce burnout. Creating a healthy, high-performing workforce requires addressing burnout early and supporting employees. To prevent burnout, both employees and organizations must identify its symptoms and take appropriate measures. That's all from me. Thank you.